everyone, we hope you're all having a great day. We appreciate you taking the time to join us for the latest episode of our Microbiome webinar series. Today we welcome Dr. Nelson Carvalho, Research Assistant at BioBase at Porto. Nelson's expertise include food microbiology, gut microbiota, probiotics, prebiotics and gastrointestinal tract stimulation, with a particular focus on the relationship between diet and the health of humans and animals. His talk is titled Sustainable Solutions for Gut Microbiota Modulation from Discovery to Application. At the end of the webinar, you'll have your chance to share your thoughts during our question and answer session, so feel free to drop your questions in the chat box and we'll answer them at the end. On behalf of Don with the Scientific, we hope you enjoy the webinar.
Greetings, I hope everyone is doing well today. Before starting, I would like to thank Don Whitley for the invitation to participate in this webinar series, and for the opportunity to share with you the work I have been developing over the past few years. As shown on this slide, the work I will be presenting focuses on sustainable solutions for the modulation of the gut microbiota in humans and animals, from discovery to application. Before I dive into the work I'll be presenting, I would like to take a moment to share my academic and professional background. First of all, my name is Nelson Mota de Carvalho. I'm a Portuguese researcher. I hold a bachelor degree in microbiology and a master degree in applied microbiology from Universidade Católica Portuguesa. During the final year of my master program, I completed a 9-month Erasmus internship at the Department of Food and Nutritional Science at the University of Reading. My research during this time focused on the impact of entomophagy on the human gut microbiota. In 2019, I began working as a laboratory assistant with the anaerobes team on the Alchemy project. My work promising result led me to pursue a PhD in biotechnology, specializing in microbiology. I completed my PhD in 2024. In late 2023, I joined BioBase, a company owned by Engenho Madalena, a leading sugarcane producer in Latin America. I currently work as a research assistant, contributing to the development of innovative and sustainable solutions. The mission of the company I work for, BioBase, is to transform scientific breakthrough into an innovative product that fosters exponential growth, maximizing shareholder value, and address critical global health challenges by optimizing nutrient flow throughout the food chain, from soils to plants, animals, and ultimately humans. My work is directly and indirectly linked to 6 of the 17 Sustainable Development Goals adopted by the United Nations in 2015, which are the goal number 2, 3, 9, 12, 13, and 15. These goals were established by the United Nations as a universal call to action to end poverty, protect the planet, and ensure that by 2030 all people can enjoy peace and prosperity. In this presentation, I will address 3 key themes: health, biotechnology, and sustainability. A relevant intersection of these themes is sustainable food and feed. While there is no legal definition of sustainable food and feed, they are generally understood as those produced with minimal environmental impact, for example, reduced greenhouse gas emission and carbon footprint, also with lower industrial costs and improved health outcome for consumers. Today's bioeconomy embraces this principle, striving for minimal environmental impact, climate change mitigation, and access to sustainable and nutritional food. Key points to consider during this presentation are gastrointestinal tract, microbiome, and food-feed matrix. It's important to understand the gastrointestinal tract of monogastric and ruminant animals, the physiological events that occur within them, and how these processes can be effectively simulated. Identifying the areas of highest microbial concentration and selecting appropriate biological sample is also critical for accurately replicate the gastrointestinal environment. For example, if we pretend to simulate the rumen fermentation, we collect sample from ruminal fluid to collect the microbiome associated to that fermentation. Additionally, choosing a suitable food matrix for this model is essential to evaluate the impact of several ingredients. It's important to clarify the concept of food, which is any substance consumed by an organism for nutritional support. Food provides energy and nutrients required for growth, health, and overall well-being. The definition of functional food has evolved over time. but is commonly recognized as food that offers health benefits beyond basic nutrition. Functional foods are characterized into three groups based on their preparation. The conventional food, which are the unmodified foods such as vegetable, meat, and grain. The fortified or modified foods, which are food that was supplemented with food ingredients, and food ingredients. Also, the presentation of feed metrics, the physical form of the feed, for example, if it's in a mesh or pellet form, influence the viability of nutrient being assessed. So what I do in BRBs? My role centers on supporting the development of innovative food and feed additives for human and animal nutrition, including species such as cattle and poultry. This is achieved through the application of in vitro gastrointestinal models designed for both humans and animals. For those who may not be familiar with this concept, gastrointestinal in vitro models are laboratory protocols designed to simulate the digestion process that food undergoes throughout the gastrointestinal tract from mouth to excretion. The term in vitro comes from Latin meaning in glass. In modern science, it refers to experiment conducted outside a living organism, in an artificial environment, using cell, tissue, or other biological components taken from the organisms of interest. As shown in this image, different organisms have unique anatomic structure performing similar functions, or in some cases, distinct organs with specialized roles. Imagine in the case of the poultry, as you can see, they have similar phases of gastrointestinal tract to the human. However, they have different organs to do that. While in the ruminants, we have a physiological process that occurred before the gastrointestinal digestion phase, that is the ruminal fermentation phase, that is unique to ruminants. In the different stages occurring within the gastrointestinal tract, several parameters can be assessed. Here, I present an example of analysis we typically perform at each stage when aiming to evaluate results related to protein or to the microbiome. For example, if you want to analyze the difference of the impact of different supplements on the protein content present in the digestion, in the gastrointestinal digestion phase, or in the intestinal absorption phase, we do this analysis. If we pretend to study microbiota modulation of the supplement, we perform microbiome analysis in the fermentation phases. This provides a clear view of how we approach specific evaluation tailored to the objective of our studies. So, why they are important? They are considered a first step strategy for screening functional ingredients, allowing us to assess their impact on gastrointestinal environment and gut microbiota. A considerable number of studies have recognized that the gut microbiota is a critical factor for intestinal health and overall host well-being, playing a fundamental role in the host intestinal development. Currently, one of the key areas of interest for the food industry is to evaluate the prebiotic potential and impact on gut health of innovative compounds incorporated into the food matrix. The advantage of in vitro models include to be easier to operate, being flexible to simulate different intestinal conditions, be reproducible, be cheaper and less time consumer compared to in vivo models. They also raise fewer ethical concerns compared to animal study or human clinical trial. However, it's important to emphasize that in vitro models do not replace the need for in vivo studies to bring products to the market. As you can see in this slide, these figures summarize and highlight the importance of gastrointestinal models, illustrating a decision-making process that demonstrates the use of in vitro models. Notably, the blue rectangle excludes reference to economic losses, animal casualties, or adverse effects on human volunteers. If you note at the beginning of this presentation, in BR I'm linked to a platform that is the Microbiome and Biotransformation platform, that when the analysis of a potential food ingredient or fortified food is proposed, we follow a structured workflow, in which the step number one is the literature review. This step helps identify existing studies, potential food metrics that justify its use, and the target animal or population that could derive the greatest benefit from this fortification. Step number two is bioactivity study. We assess in this step the bioactivity associated with the ingredients such as antioxidant, antimicrobial, antihypertensive properties, among others, as well as the impact of gastrointestinal tract process on the product. And finally, step number 3 is the real-world study. If the results from step 2 are promising, we proceed to real-world studies, including clinical or animal trials, to evaluate the effect of introducing the ingredient into the diet of the individual well-being. After these 3 steps, we assess either the ingredient of fortified food has a beneficial, harmful, or neutral impact. This enables us to consider potential application for other products. For this presentation, I bring a case study focusing on sugarcane bagasse lignin. Sugarcane bagasse is a byproduct generated during the sugarcane milling process, which produces products such as sugar and ethanol. It is one of the primary residues for sugarcane in the production of these goods. Lignin, a key component of plant biomass, is one of the most abundant sources of renewable aromatic structure on the planet. It is a complex phenolic macromolecule. The potential use of underutilized residues from agro-industrial sources, which currently lack direct applicability, offers a sustainable approach within a framework of a circular economy. This strategy not only reduces waste generation, but also provides a sustainable alternative for valorizing underutilized byproducts with potential application in monogastric animals nutrition. As you can see, here we propose a study that is similar to a step 2, which is the in vitro application, in which sugarcane bagasse lignin was proposed as a potential prebiotic additive for poultry nutrition. It was incorporated to 1% into commercial broiler feed and tested in 2 forms, mash and pellets. The prebiotic potential of sugarcane bagasse lignin supplemented feed was evaluated using in vitro gastrointestinal tract model developed by our team. This methodology included collecting cycle content from 18 broilers at 38 days of age, which were pooled to prepare a cycle inoculum for fermentation simulations. Important to mention that the inoculum preparation of this study was prepared in anaerobic condition in order to guarantee the viability of all bacteria present in the cycle contents. So in this study, 4 different chicken feed were tested, which were the mesh baseline feed. The mesh baseline feed supplement with 1% fructy oligosaccharide that was used as our positive control, since fructy oligosaccharide is considered a prebiotic. The mesh baseline feed supplement with 1% of sugarcane bagasse lignin, and pellet baseline feed supplement with 1% sugarcane bagasse lignin. Inocular control, which involves cycle fermentation without a substrate, was also included to establish baseline conditions. Key parameters assessed during the second fermentation include growth of beneficial bacteria, lactobacillus and bifidobacteria, production of short-chain fatty acids, a state propionate and butyrate, organic acids like lactate, and ammonia was also measured. This comprehensive approach allows us to evaluate the impact of sugarcane bagasse lignin supplementation on bacterial growth, organic acid production, and ammonia production, providing insight into its potential as a sustainable feed additive for poultry. Regarding the assessed feed, the results show that the addition of sugarcane bagasse lignin to mesh chicken feed is the condition with the highest promotion of bifidobacteria, even higher than fructooligosaccharides. Pellet form is shown to be the condition that least promotes bifidobacteria between the feed form tested. At the end of second fermentation, all tested feed had the same lactobacillus promotion. In regards to organic acid production, there is no difference between the mash feed condition. However, it's observed that the pellet condition had less organic acid production. Regarding ammonia production, there are no difference between the feed condition tested. Sugarcane bagasse lignin presents as a promising sustainable prebiotic feed additive for poultry when supplemented in mash feed diets. This finding supports its potential as a viable alternative to conventional feed additives, aligning with the environmental conscious poultry nutrition strategies. So after seeing promising results in step 2, then we proceeded to step 3, a real-world case, in which we aim to assess the effect of the incorporation of sugarcane bagasse lignin at 1% into broiler chicken baseline diets on the second microbiome. Then a case study was elaborated and performed to evaluate evaluate if sugarcane bagasse could be used as a functional ingredient in chicken feed, assessing possible effects on the animal cycle microbiota and performance. As you can see, several parameters on the microbiota modulation are present in this slide. So the first thing we did for this study was extracting the lignin from the sugarcane bagasse, as according to the previous study we did. The second was formulate the baseline diet to meet or exceed the bird nutritional need from each stage of its development. Finally, an animal in vivo assay was performed. A total of 108 chicks were separated in two groups, fed either a basal diet or a basal diet supplement with 1% of sugarcane bagasse lignin. Bird performance were measured, in which we take note about the body weight, the feed intake, the average daily gain, the feed conversion rate, and the mortality. And the psychomicrobiota was quantified by PCR and plating, and the second volatile fatty acids were quantified by gas chromatography. In this study, regarding animal performance, no difference was observed between tested treatments. However, regarding cyclobacterial and metabolic profile, the sugarcane bagasse linear treatment increased cycloostate and butyrate and reduced number of enterobacteriaceae, results that can be seen as positive health indicating markers. These results demonstrate that sugarcane bagasse lignin has a beneficial impact when supplementing baseline diet, highlighting the potential of byproducts as eco-friendly alternatives to feed additive supplementation. In this case, we conduct step 2 and 3 and obtain promising results and key performance indicators. Next step could be the increase of the number of animals tested to verify the consistency of these positive results. With that, I conclude my presentation. I hope you now have a clear understanding of our platform in Biorbis, its role in identifying potential sustainable ingredients, and how we can incorporate them into food and feed metrics to enhance their quality and beneficial effects on the host. Thank you for your attention. If you have any question about this work, feel free to ask.
Hello, everyone, and thank you for logging into our webinar today. I hope you found that interesting, and I do have some questions for Nelson here, who's now able to join us live for the Q&A session. So I think, to me, one of the important things for this kind of gastrointestinal model is what you use to inoculate it, the biological sample that you use to represent the gastrointestinal microbiota. So how do you control that? And what precautions do you take when you're collecting the material to use as the gastrointestinal microbiota?
Hi. So first of all, thank you for having me here. So answering for your question regarding the inoculum, that's true for this model that I present today in this presentation. Inoculum is kind of a keystone to make them work. So the precaution that we have here is to ensure them the microbial community remain as close as possible to the in vivo. So first thing we have to do is preparing the biological sample within the first 4 hours of collecting the sample. Collect the sample after defined fasting period to reduce the metabolic variability associated with active digestion. Another thing is confirm that the biological sample comes from a clinical healthy host, animal or humans, from clinical health. Another thing that we do is working in anaerobic conditions and quick as possible. So working inside of an aerobic chamber is a one of key parts on working with these type of samples, like fecal inoculum or ruminal inoculum. We work in a neuro condition to make sure that strict neurobacteria are not losing their viability. Another thing I'm thinking is the solution that we dilute the biological samples, like the fecal inoculum. Here in our lab, we work with hypertonic solution like PBS, phosphates, phosphate saline buffer, phosphate buffer saline solution with a cryoprotector to make sure that when we store at a lower temperature, like -80, that the viability of the bacteria are in good state. And we normally work with these samples between a time frame of 3 to 6 months, no more than 6 months. So the experts are the key ones from the inoculum that we work in these models.
Okay, thanks very much. That makes sense, and we're getting some very positive responses. Great presentation, interesting work here, and some more questions too. So, one here: how do you define a prebiotic effect? Is it an increase in lactobacilli or bifidobacteria, or just short chain fatty acids? And
So
also to complete the
as
question, is there an upper limit for the increase in short chain fatty acids that needs to be avoided or not exceeded?
So that is a good question. So the first thing we have to think about prebiotic, we should not limitate about the concept of lactobacillus, the growth of lactobacillus or bifidobacteria, because prebiotic is a promotion of beneficial bacteria to the host.
Yeah.
So in a long time, let's call that, normally we're looking for that specific lactobacillus and bifidus because are the most famous ones. But through other beneficial bacteria are present in the gut microbiota, and they also have that promotion. But it's indeed lactobacillus and bifidus are associated with promotion of beneficial impact to those. But you should be careful because also in some articles and other study we see that higher number of lactobacilli are associated with gastrointestinal disorder or other aspect. So
Yeah.
we need to be careful when you are talking about prebiotic effect and promoting lactobacillus. For that, it's important when we work with in vitro, only promotion bacteria is an indicator, true, but we have to go to the real case to see if the health state maintains. The question really regarding the short chain fatty acids. Um, Upper limit, I'm not sure how to limit this, but I know that if the ratio is normally acetate propionate butyrate are the main short fatty acids, are like 95% of short chain fatty acids produced in the gut microbiome, and that normally they have a ratio from 3:1:1 to I don't know the upper limit. That in, indeed is this a ratio, and should the production of the acetate propionate butyrate should be within that range. So if imagine we have a lot of propionate higher than acetate, something's wrong there. So
Yeah.
normally we need to be careful when we analyze short chain fatty acids because the production of that short chain fatty acids are normally within a range, and we can see that. But
Yeah.
normally
Excellent.
outside of that range, should be careful, understand that something could be wrong or the analysis are not well performed.
Yeah, sure. I think from my experience, it's the ratio rather than the absolute quantities, isn't it? That tells you if something's normal or
Yeah.
perturbed. Yeah. So, okay, another question here. Are the models that you presented used only for testing the impact of functional ingredients, or can they also be used for other studies related to modulating the gut microbiota?
So the model I present here are very versatile, are not limited only to analyzing the supplementation of functional ingredients. We can also investigate, for example, the proliferation of pathogenic bacteria or the response to prebiotic treatment. Imagine in our labs we already assess the impact of several protein source from animal and vegetable. um, to see the impact on the composition and activity of the gut microbiome. Another valuable application that we already test is to see the contamination in food products and see how that impact gut microbiome, and the treatment to that food product to see the impact on the gut microbiome. Also, we already test the impact of different probiotics to see which one could will be better used for the treatment of a pathogenic proliferation. Another thing I'm thinking is testing, imagine fecal microbiota transplantation. We can be using this model is an option. So it's not the model I present here not only go for food application, but can use for other aspects. So, and you can imagine, I will give the case of the chicken. We could, with the same functional ingredient, test different feeds to see which one would be better suited. Also, could be an option here.
Yeah, sure. Thanks very much. Another question here. Today, you've told us about chickens and the use of sugarcane byproducts. Have you tested any other byproducts from food or agriculture, either in poultry or other species? And have they shown any good potential?
So, from the to answer to that question, yes, I test several byproducts derived from agri-food sector. From the chicken perspective, the poultry perspective, from the in vitro, the one that had the best results was the one that I present today, the sugarcane bagasse lignin. That was the reason that we went to the in vivo assay, and also again had good results. In cows, if I'm recall correctly, the one that we have better result in vitro and went to in vivo was span yeast from um, spent yeast from the industry that we receive, and were interested to see that, and we had good results testing in calves. We added that supplementation of spendings in the milk replacer during the first 35 days of living of the animals, and we saw that increased with the bacteria in the feces of that calves. So yeah, we tested several byproduct, and from my perspective, these two one are the more that highlight in my mind when you make that question.
Okay, yeah, thank you very much. And one more here. When you refer to supplementing animal diets with these functional ingredients that promote beneficial bacteria or indeed reduce harmful ones, reduce Enterobacteriaceae, for example, what are the ultimate tangible benefits for the farmer and for industry?
Mm. First thing comes to my mind is the improvement of intestinal health. As you say, promotion of beneficial bacteria and the decrease of harmful bacteria. This allow us to lower the risk of gastrointestinal disease and consequently reduce the need for antibiotics, something that is increasingly valued, the reduce of that antibiotics. Another thing I'm thinking is enhance of feed efficiency. As a healthy microbiome improves nutrient digestibility, which can lead to a better zootechnical performance. In other words, is gaining weight with less feed. Also, from the economic benefits, if you think about it, healthy animals means lower mortality, fewer veterinary interventions, and a shorter production cycle, of which will directly affect the finance of this industry. I'm thinking from the commercial point of view, the production will animals that will be on sustainable feed ingredients have a product differentiation. Consumers are increasingly interested in meat produced from more sustainable methods and less antibiotics, which can result in higher value for the market. And for a sustainable perspective, if you think about which this helps to reduce the waste and adds value to the supply chain, which also supports the corporate environmental and sustainable goals from each companies.
Yeah, I'll continue on that theme, actually, talking about sustainability. So, how do you see the role of functional ingredients derived from agriculture in mitigating climate change? Is there a possibility here?
In my own opinion, this aspect I think is the most promising and urgent strategy to promote sustainability, since we are converting something that was underutilized into something that can promote a positive impact on the animal health, increasing feed efficiency, and reduce the emission associated with livestock production. Another thing is related with restriction of antibiotics or the ban of the antibiotic in some parts of the world, which something that industry are looking for because it's a issue. The antibiotics, since 70% of the antibiotics are used in agri-food industry.
Yeah.
So that part, I think, the sustainable functional ingredient could be a next step to improve the issue related to climate change, and also increase circular economy. Is something that you not use can be used from other industry, and yeah, I think from my perspective is a most promising strategy.
Perfect. Thank you very much. Well, we don't have any more questions coming up on the screen right now, but I do appreciate that many people will be watching the recording of this. And I would say to you all, if you do have any questions that come up, then please send them in our direction and we can pass them on to you, Nelson, if you're happy with that.
Yeah, I'll be send me the question. I'll be happy to answer everyone.
Fantastic.
If you are interested on the topic, I'm free to talk with you by emails. You can see on the presentation my email, so feel free to use.
That's great. Thank you very much, Nelson. So
Thank
thank
you.
you for joining us today, and thank you to the audience for logging in too.
Thank you.